Suction's really changing the way we do ureteroscopy. We're now exploring different ways of removing stones to get better results for patients. There are several areas that suction will help. One is hopefully removing more stone from the kidney. Secondly, it will allow us potentially to operate at lower pressures, and lower pressures can mean higher flows, which also means thermal injury is less likely.
I think it is a very unique technology. So this essentially is suction, direct in-scope suction, because so far we are doing little bits with the syringe, but it's not great. With this, you have a full control. The suction works really well. You can control the amount of suction, and it is very intuitive. So it keeps the pressure low, the temperature low, and the vision is a little bit better. But because you are in control, you can adjust how much suction you want. So overall, I think it's a really interesting aspect in endourology, and it really helps clinicians, especially in difficult cases.
Since this was released in the market, I think it has been a complete game changer. We are also performing studies in vitro, ex vivo, and in our patients. From every perspective, the results are very, very good. You can combine this with fans or use this alone. Probably the best cases to use these are infective stones and big stones. This is expanding the indications for flexible ureteroscopy. So my opinion is always good.
I think it's all about suction today, and what I like with direct in-scope suction is that it's implemented and available so in every scope. So I can make the decision if I need suction or not just during the procedure. So that is a real advantage compared to the sheath where I have to make the decision beforehand.
I mean, I must say I'm very impressed by Pusen, by the way, because the whole world is miniaturizing, and incredible that Pusen have just pivoted and have gone totally the other direction. And the working channel of 5.1, what an incredible idea. Working in the lower pole makes it easier for you to suck fragments. It means you're reducing intrarenal pressure, reducing intrarenal temperature. So having a scope that can actually ease that burden, better drainage, it's a big game changer.
Well, I think it's a very interesting topic, and it's growing very fast and rapidly. Putting all of this together, having a scope that has suction within, controlling the intrarenal pressure and clearing the vision would really help developing more and more flexible ureteroscopy.
So I think that the marriage between endourology and suction is forever. We are learning some tips and tricks. We are learning about settings. We are learning about pressure. I truly believe that there is a strong link. It's safer and it's successful.
I was thinking that with a 9.2, I would have firmly connection or attachment to the scope at the fragment to relocate, but it was the vice versa. So the theory behind this is that you aspirate the water, and once there is no water inside the calyceal system, you don't have the attachment anymore. We have bigger working channel, which brings us to the point that we will have better pressure control, but at the same time we have also a higher irrigation going inside the kidney, so we have to take into consideration also this. With the wider working channel, we have higher intrarenal pressures, but at the same time faster decline of the intrarenal pressures when we're pressing the suction button.
We have switched almost exclusively to using DISS in our hospital, and we're really happy, especially for the cases where we have big stones or where we have infection stones and are worried about infection and sepsis. It has proven a very good tool.
I think since the introduction of DISS, we've been understanding the way it works more and more. After a few cases, not many, I would say, you start to realize how this technique can be helpful in your cases. It is a very good technique, provided that you are very keen on dusting a stone rather than fragment. You need to keep steady with your technique and realize when it becomes the best time to use the suction. I really like the fact that it comes together with a very thin scope. To me, is something that I find useful.
I think suction through the scope is most helpful when you don't want to place an access sheath if the ureter is maybe small and the scope you can only access the kidney with a smaller scope. Our research suggests that with a 3.6 French working channel, fragments up to about 1/4 of a millimeter can be aspirated reasonably well. With a bigger working channel, such as 5.1 French, up to about 1/2 a millimeter can be aspirated. Low pressure, removing small particles.
So I remember at least one very nice case. There's a patient with almost like an abscess in the kidney, and you had to go and you had to suck all the infection, and having a DISS scope really was helpful in sucking out directly through the channel. Otherwise, if you use a syringe, you would not have been able to achieve the same. and it was very easy to do it. Would I use it in every case? I think there is an advantage in using it. You may not need it in every case, but having that advantage, having that option is definitely a game changer.
Big infective stones, it's always super helpful. It helps you keep the intrarenal pressure low, it reduces the intrarenal temperature, and it also aspirates dust and very small fragments. If you have a good balance between the inflow and what you're aspirating with the outflow, you can keep the intrarenal pressure at safe levels, you can have clearer view, and the surgery goes faster, which is actually very important in infective stones.
I had the chance to do a few cases with your new bigger scope. I was quite impressed how good irrigation flow can be, even if you use instruments like laser fibers or baskets. So I think it's interesting. We have to figure out for which indications. I think most of the patients require freestanding. On the other hand, most of our patients have freestands. So I'm really looking forward to collect more experience with that.
Especially in those infection stones where we really need to get everything out of the stone. It's nice to see a result where you can clear all of the small dust. Especially when using a TFL laser, we found that it's really helpful.
Since the suction comes through the scope, it allows you to reach places like some calyces with a narrow infundibulum, and you can travel through them and getting in the calyx and aspirating even in complex anatomical situations. So I would say that those could be the best situation for me and the best indications for suction through the scope.
I'm very excited about the possibilities for AI. Healthcare is really behind the rest of the industry in terms of delivering AI products. I think in the next few years we'll see automation and calibration being done with the image, and also controlling the best ways that we deliver results for patients.
So look, a game changer is something that improves patient safety by keeping the temperature and low, pressure low, better vision, improving patient stone-free rate, and actually once you're fragmented into dust, having some aspiration. So for a game changer, you have better safety, you have better stone-free rate, and it's easier to get access because it's a smaller scope.
I consider nowadays we're looking after pressure significantly. So now we're keeping this in mind more than ever. We will need also some device to monitor temperature, because now with the high power lithotripsy, laser lithotripsy, the tissue can be damaged. And I think this should be considered as well and looked after.
It's all about suction and optimizing laser settings. I had a very nice experience when I tried your new 9 French scope some weeks ago the first time. I combined it with a suction sheath, and that was super impressive. What I expect in the future due to the developments in laser technology, in whatever suction technology, we will do more and more stones without puncture.
Endourologists are constantly moving. Now the question is, how efficient can we add stone lithotripsy? How much, the whole idea of what is the end game? Stone-free rate. You want to do least damage to the patient and get the patient stone-free. Can you do bigger stones with the flexible uteroscopies? So are we now moving a paradigm shift where flexible uterorhinoscopy increase utilization of flexible uterorhinoscopy versus PCNL? But with the fact you have direct in-suction scopes, you actually know wholeheartedly that you've cleared every single fragment of stone. So that's quite new.
Game changer, definitely suction, and maybe the intrarenal pressure monitoring, and even with the evolution of dust, they had the issue of vision during the dust procedure. So having, the direct in-scope suction or the suction per se, really is a game changer and pushed the limit for flexible ureteroscopy indications.
Any advance will have suction inside. It's clear that suction will be part of the next step.
I really believe that the direction will go towards the FANS DISS, so FANS plus DISS. In this concept, I love the working channel of 9.2 with wider working channel, because you have higher irrigation, and since there is higher outflow from the FANS, will give us a possibility to see the stones better. Probably if it can fit the higher irrigation, better irrigation can fit in 7.5 French, it might be a game changer with FANS.
I think recently it has to be suction and also miniaturization of the instruments. And I think both of those combined is a real game changer for us.
I can tell you about my dreams for future procedures. I can think of factors that are able to control intrarenal pressure and temperature. If you're able to have suction which lowers intrarenal pressure, at the same time to have a better use of irrigation coupled with suction, that could somehow help at the same time both safety and efficacy of your procedure.